Well, come back to our next session. Our next session we are going to have one session that is on supervision. All of you know, as a nurse administrator, you have to supervise your subordinate. So you must know what is supervision, how to do supervision, what are the qualities of supervisor. So we have our resource person, though all of you know, all of you have seen, Professor Dr. Mrs. Bimla Kapoor, all of you know, and she is program in charge of BSc Nursing also, and she has written few units in a Diploma in Nursing Administration, and she has taken supervision class for at RAK College of Nursing for so many years. So she is here. I think she will be able to take a very good session, and I request all the students, those who are Srinagar or other center or Delhi, you must ask question. So because we want you should be good supervisor. So you come to know from madam who everything about supervision and ask the questions. So madam, please initiate your session.
Thank you so much, Mrs. Sarkar. For me to talk about supervision would be like any nursing person, whether you are a staff nurse, ward sister, ANS, DNS, you have some or the other supervisory role. As a staff nurse, you will ask me what supervisory role we have. You have a supervisory role to see that the patient is sleeping properly, patient is comfortable, patient's relatives are comfortable. So each one of you would have a level of supervision. Some of you would be only a supervisor to intervene, to guide, to direct your subordinates, but some of you will be supervisor to see that the patient is getting the proper treatment and nursing care. So that is why for any nurse, may we have the slide please, for any nurse administrator to be effective, it is essential to understand the principles and functions related to the job. I say principles because if you know the principle of nursing is to provide the quality care, then the function will be related to that job. That means to provide a quality care, patient should be made comfortable, the treatment should be given on time. As the primary emphasis of nursing department is to provide high quality care to the patient, the most effective use of resources, support and participate in education to maintain the excellent care given to the patients. It is possible if only an effective chief executive in nursing with excellent supervisory abilities and capabilities is there to provide leadership to the nursing personnel to manage the particular ward. So a supervisor is the one who is going to actually carry the name of the hospital. A nursing supervisor is the one actually who is going to say that this is my ward and these are my nurses and I am there to see that my patient gets excellent quality care. And that's where her supervision, her leadership qualities come into helping her to provide that quality care to the consumers. Now if you look at the word supervision, supervision means overseeing, looking at something or looking above something or checking, looking over. Now looking over, in other words, it refers to an act of a senior person, of a supervisor to see the work of personnel who are working under her or him. Now is it always that she or he has to see or supervise or also assist? If you look at our next words, next definition, it says supervision includes directing, guiding, inspiring, motivating, helping and advising the subordinates to improve their performance in achieving the established objectives. Let us explain this little more. When we talk about directing means when you as a supervisor go to the ward, you find a particular nurse is running up and down to do something for the patient. Now as a supervisor, you just cannot go and say, why are you running up and down like that? Probably you will tell her as a supervisor, there's something troubling you. Tell me what is it? My patient is hypoxic. She needs oxygen immediately. I do not know where to get the cylinder. Okay, you look for one. I'll go and find out from the ward sister. Now that is what is directing. Go ahead, look for one, and I'll look for another one so that your patient is not going into hypoxia or anoxemia. Guiding a particular person. For example, a nurse in the ward finds it very difficult sometimes to take the orders from so many physicians at a time. So she needs guidance. How should she handle all the SOS instructions? So there we may have to guide. Then let us see that talk to your specialist or HODs that everybody should not come for the round at a time. They should come, somebody should come at 8 o'clock, then 8:10, 8:20, so on and so forth, so that you have time in between to give instructions to your subordinate, to your juniors, to carry on the SOS instructions, and the patient doesn't suffer. Inspiring. A nurse, a supervisor who herself is enthusiastic, full of energy, full of ideas, and is active to help the nursing staff in the ward will become a role model to inspire this particular nurse that how she can carry on the activities. A supervisor needs to be very motivating. You had been doing very well. I saw you struggling with the patient, but what you could do more is call somebody for help. So you are not demotivating. First you are motivating, plus you are also guiding her that do not take something which you cannot do on your own. But instead of saying this, you say that you were really helping your patient very well, you are doing very well, but call for somebody to help you so that your patient gets maximum help. So these are the motivating kind of comments which a supervisor needs to give, helping and advising the subordinates. So I thought we should really decipher these words which has got lot of meaning. Supervision is also called as teaching learning process. Now this is a teaching learning process because there is a constant observation by the supervisor. So supervisor comes to know that my staff nurses by 12 o'clock they get very exhausted. What do I do for them? Okay, what I do is that by 11 o'clock I'll tell two of my staff nurses to come to the duty room or to come to my store to have a cup of tea. Other two can take the workload. So this is a human relation plus also making constant observation. Now which is the time when my staff nurses are very busy. So during that time I will not disturb them, but I can make notes on the medicine book so that they can carry on some other activities. So this is the way of constant observation that teaching learning process takes place. Monitoring the activities of the nurses. Two of my staff nurses are very active, very alert. The other two take the advantage of situation and they go into the side room. So I have to see that how the work is distributed to all my staff nurses. Guidance to the workers to enable them to perform their activities effectively so that the patient gets best care and the organization goals are achieved. Remember, every hospital or every organization goals are to give effective care to the patient. When we talk about effective, we mean to say therapeutically effective, cost effective. And also the patient should be able to go to the community to become socially productive so that he or she becomes effective for his or her family. So this is what is that required standards which a supervisor wants should be maintained, whereas she has to have the constant observation and also monitoring and guiding. That is why we say that supervision is a teaching learning process. If you look at our next slide, I think the slide is missing. Let's say supervision is also called as dynamic social process. Why do we call it as a dynamic social process? Because we are dealing with human beings. Not this slide, please. Oh, thank you so much. Thank you. A two-way dynamic and a social process. That means that we are dealing with human beings. And human beings have complex needs. There is change in their condition. If the fever is very high, if the cold sponge bath is given, the fever may come down and immediately the patient will start feeling very hungry, needs food, feels restless to eat something. So that is what we say, it's a dynamic process. It's a social process because we are not dealing with machines. We are dealing with human beings who have got their culture, who have got a society from where they come, they belong to a community. So as you see supervision, we are also dealing with the nurses, ward sisters, or the patients. So staff nurses and ward sisters also come from a social background, though they all are homogeneous in terms of their nurses, but still there are certain ideas with which they come for which we need to help them. Undertake supervision is also explained as undertaking the specific purpose of fulfillment of organizational goal, which I mentioned a short while ago. Also by striving to maintain the required quality of performance, very important. The quality care to the patient is more important, and rather than wasting time. And if we give comprehensive nursing care to the patient, you will find the improvement to the patient will be much faster and it will be cost effective. And that's what is one of the objective of the supervision. Also, support and assistance to the worker, not for the wrong deeds. If the worker has not done the activity properly, you are not going to support, but you are not going to scold her or him in front of everybody. At that particular moment, you tell her to carry on the activities, and later on, as a supervisor, you call back to her in a separate place and tell her where all she had gone wrong and what all the improvement should be done. And this is what is important function of supervision. Also working for what? Working for methods and procedures which are to be followed by the workers. See, we need to develop these kind of methodology and procedures. Just supervisor going with the paper in my hand all the time and noting who's not doing what she or he has to do is not a supervision. That is called criticism. When I talk about supervision, I want to see that these are the guidelines developed to admit the patient. Is the nurse following those guidelines? If not, what is the reason? Is the load too much? Are there too many admission and she is not able to manage alone? That means I will have to see what nursing personnel or infrastructure I need to provide so that he or she is able to carry on that work effectively. Also, quality of performance. What do I mean by quality of performance? Have I prepared a checklist? Have I prepared a checklist as a supervisor to know that whether my nurses are providing the quality nursing care or not? Have all the nurses taken over properly in the morning hours? Yes or no? Have the nurse, the ward sister given the responsibility of the serious patient to two nurses? Yes or no? So that is the criterion against which the quality will be measured. So as a supervisor, I should also have that, and I must let my staff nurses know that the quality of care which you are going to provide will be based on these criteria. It is not something hidden. See, we cannot compromise with the quality even within for 1 minute, because we may lose the life of a patient. So that is why it should be, everything should be known. Everything should be discussed so that the nursing personnel know that what care they have to provide the quality, and that's what is the important function of a supervisor, or supervision is also known for these things. Now, if you look at our next slide, we will. It talks about supervision. Can I have the next slide, please? Supervision is also called as.
No, not aim of supervision.
Supervision, we have talked about this. Let's take the next one. What could be the aims of supervision? The important aim which I am discussing from the beginning is to improve nursing services. No matter you come with a very higher education, a doctorate, or MPhil, or MSc nursing, nobody is going to read your labels what you are. But when you provide nursing care to the patient is going to make out the difference and say, sister, you are a different nurse. Why are you different? So this is your knowledge, your skills, which are going to demonstrate on the nursing services. And the way you give the care to the patient is going to reflect on whole of nursing services, and more so on the hospital, and word of mouth of the patient conveys to the community which hospital is good, where you should go for the nursing care. You will get very good nursing care over there. To maintain standards of nursing care like safety of the patient, providing comfort to the patient, providing privacy to the patient, providing therapeutic intervention immediately. You see, if the antibiotic is to be given at 10 o'clock, we cannot think of giving at 12 o'clock. It has to be 10 o'clock because the next dose is at 4 o'clock. If you are delaying, the whole cycle gets delayed, and that may not be effective. The antibiotic given to the patient may not be effective. So maintain standards of nursing care in terms of therapeutic efforts, in terms of safety, in terms of comfort, in terms of psychological support which the patient requires. Also, as a supervisor, we need to see the aim should be that the effective nursing care is also given therapeutically. For example, if you find that the patient, suddenly you go to the ward and patient complains that I have got very bad pain on my gluteal muscles, and immediately as a supervisor it strikes you. What happened to my staff nurse? Has she been given right injection? Has she selected the site properly? And then you first see the patient. You put a screen and you tell your staff nurse come and help you, because as a supervisor maybe you don't have so much of time. You put a screen around the patient and you call the staff nurse and you say, let us examine this patient. This patient is having pain in the gluteal muscles. And then you say, you touch with back of your hand and you find the area is warm. You find the patient's area is tender on pressing. So you say, okay, you tell the staff nurse, why don't you take little Maxulf and do the warm dressing to the warm fomentation to this patient so that the induration is reduced. Now you have done this job, but your supervision is not finished here. After that, you have to call your staff nurse and tell what therapeutic damage she has done to the patient and where has she gone wrong and what else could have happened to the patient. So these are the ways. The aim of the supervision is that you try to give the quality care, and also therapeutic effectiveness care need to be given to the patients. Efficient and quality nursing care. Now, when we talk about efficient nursing care, we mean to say the briskness in saving the life of the patient. For example, if you find, I still remember an example, where a patient was having cardiac arrest, and way back in 1968-69, the coramine injection was given by the nurses only. And as a student, you would give intracardiac coramine injection. So I remember the teacher is telling to the student that come fast and give coramine because we have to save the life of the patient. And then this particular student, second year student, is trying to set up the tray and carry the tray. And the teacher runs back and she says no. She breaks the ampule, puts the syringe, needle in the ampule and has a swab in her hand and walks fast and gives the coramine injection, cardiac massage, and the patient gets revived. Now this is fortunate for the patient, fortunate for the student, fortunate for the medical fraternity and the teacher. But sometimes the patient we may not be able to survive because patient has such massive cardiac arrest that one coramine may not be able to help. Or sodium pentothionate, what do you give? Sodium chloride. Sodium chloride will not help the patient. But thereafter the supervisor explained to the student that look, you wanted to maintain the scientific principle. Now when you are taking an ampule and covering the sterile needle with the ampule, no dust, no microorganism is falling on the needle. You have a swab in your hand which has got an alcohol base. So you clean the area. Now when you reach next to the patient, you throw the cover, that is ampule, and give the injection and massage. Now scientific principles are being maintained, but briskly, effectively, efficiently you have to carry on the procedure and the quality nursing care. So this is what we mean. Standards are to be maintained, asepsis is maintained, but efficiently the nursing care is to be carried on. Nursing care with concern and satisfaction. Satisfaction to whom? Satisfaction to self. At the end of the day, you should realize whether my patient got the care, what actually they have got, or today I have neglected my patient. I wish I had given sponge bath to my patient. She was very dirty, but I didn't have time. I hope the evening nurse will give the sponge bath to the patient. Next day morning, you go and see the patient is still dirty, and you start feeling guilty that I wish I had found out some time or told the relatives to clean some part of this particular patient. Satisfaction to the patient. Patient feels satisfied. There are many examples of the supervisors who come to the ward and the patient don't even come to know that she is supervisor. They think this is another nurse who is walking in the ward. But if a supervisor is there, goes and talks to the patient, finds out of the problem, they come to know that there is somebody to check everybody, and that is what is the aim of supervision. Also, as a teamwork. Am I satisfied of a teamwork as a supervisor? So these are some of the aims of supervision. Yes, please.
I think it is very much clear what is supervision and what is the component of supervision and what, as a supervisor, what you will do and aims of supervision. I think it is very much clear. If you have any question from the Delhi studio, from in front of us, we have 5 students. Any question? Any question from Srinagar? Any question from any other regional center regarding supervision? You want to ask anything? Yes, I think you know now, madam. Then we will go to next. What are the functions of supervision?
Okay. Now, before we talk about this function, can I just complete
Yes.
the aims? The immediate aim of supervision are good workmanship. That means, as you leave the ward, as your staff nurses leave the ward in the morning, evening, or night, the workmanship is the one which is going to speak. The patients are left neat and clean. The ward is left with all the equipment and supplies. The patients are handed over properly by the evening nurse, night nurse. This is called the good workmanship. Also focus on work. Now, what work? All the nursing care activities, whether they are carried on along with the team members, that is physician, dietitian, physiotherapist, diagnostic team, that all the nursing activities are carrying on effectively, because ultimately, don't forget, everybody's focus is a patient. And all of us, we want the patient should improve faster. The nursing care is the one which is going to carry lot of time in the ward to see to the needs of the patient. Workers. Again, it is not only we are concerned about our patient, but we are also worked as a supervisor concerned. Our aim is to see about our workers. Workers like nursing staff, to keep on motivating them, encouraging them, seeing to their welfare. If the ward was so busy, she doesn't get time to even go and munch her food, relieve her for some time and tell her to go and just sit for 10 minutes, finish up something and come back, so that you are able to work better. Many times in the ward you don't get time even to sit down and have a glass of water for 8 hours, and you come to know only at 3 o'clock, oh my lord, I didn't even have my lunch. So this is because the nature of job is like that. But as a supervisor, you have to see the welfare of your staff also, so that they don't fall sick, and the good worker you will be losing the next day in the ward. So this is what we talk about the immediate care. Mrs. Sarkar asked me to talk about functions of supervision. The function of supervision are described in a various ways, but some of the easy way to describe the function of supervision are: we need to organize the work. How do we organize the work? We need to categorize the work. What should the ward sister do? What should the senior staff nurse do? And what should the junior staff nurse do? Now, when we are talking of organization of work, there are various ways to organize. There are various systems of allocating the work. We have got a functional system of working. We have got a patient assignment method. We have got a teamwork. Now, functional assignment method is very popular in our hospitals because we have got less nurses in the clinical area, technical nurses. For example, one of you will do the injections, one of you will carry on the dressings of the patients, one of you will send the patient for diagnostic purposes. So this is called as functional method. Wherever there are more technical nurses, we have the method of what we call it as a patient care. We assign 4 patients to a nurse, and she or he provides a comprehensive nursing care from morning till evening, and later on the evening nurse takes over and night nurse takes over. So organize the work, and then work allocation. Work allocation, as I was mentioning, if it is a team approach, how will you do the allocation of work? If it is functional method, how will you do the allocation of work? But suppose you have given a duty of giving medication. Now there should be somebody else to carry on SOS order. Reason being, it is not possible for one nurse to give all 40 patients the therapeutic needs altogether. So you may have to subdivide again. If somebody has finished the personal hygiene, now can carry on and support on taking the temperature or giving the SOS instruction. Direct and guide the staff. Very important function of supervision, which I had been mentioning, how you can do the direction and how you can guide your staff time to time. Coordinate the resources, because you go in the ward and you find that the patients are lying on Macintosh. There is no sheet. From where do the patient get? Some of the patients you find that they have put the colored sheets because there are no ward sheets. So what do? Now the supervisor's responsibility is to find out which particular ward can supply at the moment the sheets in this particular ward, so that you can return it tomorrow, so that patients are covered properly and they are not lying in the ward without getting treated as individuals, without getting treated as human beings. So coordinate the resources. There is no supply of, say, intravenous bottles or no supply of syringes. So the supervisor has to make arrangements to find out why the shortage has been there, and this shortage should not be repeated. She has to see that the resources are provided to carry on the care to the patients. Control staff. Now, controlling the staff does not mean that you scold the staff, you order the staff, the nursing personnel, but you need to control the staff in terms of time management, in terms of work management, in terms of management of patient care. Also, there are various category of staff to whom you have to control. For example, you may be having too many visitors when the cleanliness is going on. So you request as a supervisor to all the relatives that we need to see that the cleanliness goes on. Would you mind to go out for 1 hour so that we finish up the cleanliness of the patient as well as of the ward, so that you can come and sit with your patient. We understand your patient is very serious and you need to be with the patient, but till then we'll take care. And then we'll call in case there is an emergency. So this is controlling, helping the staff to control the whole ward management. Evaluate the performance, very important, because one particular staff nurse or ward sister is very active, is saying, but what reward is she getting out of it, Have you ever sent her continuing education program? Have you ever given a pat on the back? Have you ever said in a meeting, in the ward sisters meeting or in the meeting of nursing supervisors, I am proud of my this particular ward sister, and I'm sure all of you are also doing very well, but I did not get an opportunity to come and see you. Maybe you are also better than her. But what I have seen of such and such ward sister, I wish all of us were like this. I was not so good as you are. So there's no harm to give this kind of comment. And also, you need to do the performance evaluation of staff nurses and the ward sisters, and there should be a criteria checklist which is given in your books, how to prepare the checklist to do the evaluation. Even evaluation of activities which you are doing in the ward. Have you finished giving injection to the patient on time? Have you given the SOS instruction to the patient? Have you done send the patient on time for diagnostic procedure? Have the reports been received? Have the reports been attached? Is the treatment of the patient started? These are so much important when we talk about the patient care, and supervisor has to see that these functions are carried on by the staff nurses, and when she evaluates the performance, she says that what are the criteria on which you are being evaluated and where have you run short in your evaluation. So these are some of the functions of any supervisor working as a staff nurse, senior staff nurse, or working as a staff nurse. Now let's talk about methods of supervision. May I go ahead?
Yes, it is very important, methods of supervision. As you know, as a supervisor, you will be you will be supervising, but how you will be supervising, this is very important. So, madam, I think you just tell what are the methods of supervision. Before that, I would like to ask our student here and Srinagar, other regional center, if you have any question, please ask us. Any question, Srinagar? Srinagar student? I think they do not have. If you have any question, in between you can ask. Okay, madam, continue.
Thank you. Methods of supervision, one of the very important method is a direct method of supervision. Now, what is this direct method of supervision? In this method, what we do is that observation is done. Now, observation can be done in various ways. You can be a part of your whole team and do the observation. We call it as a participant observation. We can have the observation while standing in a duty room and watching, real like supervisor. Look, I am here to see how you do the job. That's a very threatening situation for any staff nurses. If a supervisor comes, everybody runs, supervisor has come, supervisor has come. But there are also supervisors, when they go in the ward and they say, oh, today supervisor has come, we are going to really discuss our problems. So look at the two different supervisors who are coming to supervise the students, So supervision can be done by observation, and observation should be done with the help of checklist. How can I remember how all the nurses in the ward are doing? If I have a checklist, I can keep tick marking. 10 days if I tick mark, I say my staff nurse A is excellent staff nurse because she carries on all these activities in a very organized manner. Whereas my staff nurse B is mediocre. My staff nurse C needs to go for continuing education program. I'm not saying my staff nurse C is bad, but I'm saying that my staff nurse C needs some orientation program or continuing education program. Maybe the place she was working or the opportunity she got, she did not have these kind of exposures. So naturally, she or he requires an orientation or continuing education program. The other is nursing rounds. This is very important. I mean, I do not know where have those nursing rounds gone. But I remember the supervisor would come and patient to patient the report will be taken from the staff nurse or from the ward sister. Every ward sister knew about the patients. Every staff nurse knew about the patient because they knew the supervisor is going to come and take the round. And when the round is being taken, you were supposed to know the name of the patient, the diagnosis of the patient, when the patient was admitted, what are the problems, what nursing care you have given. And the supervisor would spend a quality time of 30 minutes to at least go and review some of the patients, if not all. So those were the nursing rounds, and those are the nursing rounds. The definition has not changed, but this is one of the important method where you are in direct contact with your patient, with your nursing persons. In the nursing rounds, the other approach is
Yes, call from Srinagar. Yes, Srinagar. Yes.
I'm Hasina from Srinagar, ma'am.
Yes.
I remember the days as if I am at RK College of Nursing attending your class, ma'am.
okay. Okay, it's
You are
pleasure.
so clear, and my students are very, very happy. And you have kept no scope for asking a question.
Okay, thank you.
Okay, thank you, Hasina.
And ma'am, and for asking supervision, ma'am, I can tell you the ward rounds when we take nurses rounds. It's not for HODs or clinicians when they ask their rounds. They give more importance to their round, like what is the therapeutic importance of a patient.
Very good.
Yes.
What is the care? They only are bothered about the cure because they are dealing the patient for cure.
Yes.
And we are taking care of the patients. Care is least important for them. But for our professional nurses, it's very, very important.
Right.
Keeping in mind the ratio, patient-nurse ratio in our setup, we have really become diluted in taking the nursing rounds now.
Okay, I think this is very important. She has very rightly mentioned, because when we are talking about supervision, we are talking about the care part. We are not talking only the cure part, but we are talking the care part. And care is very important on the nursing rounds. And this is what I'm very happy, Hasina, that you're such a senior teacher and such a senior person, and you are able to still practice some of the basic things which are required for your students. And I'm sure the role models are many. You can hear one of the teacher talking from Srinagar as far as that, and her students are listening to her, that what is more important and why supervision is needed. The other important thing is indirect methods. In indirect methods, we have different kinds of records and reports. In the nursing rounds, I was also mentioning, many times as supervisors, we go and talk to the patient. How are you? Did you have your breakfast? Did you clean your teeth? Who helped you to clean your teeth? Did you have your sponge bath? Could you sit up? How are you feeling today? Did somebody come and talk to you? Did you take your medicine? And then you go back and ask from your sister that whether that patient had his mouth washed. So then you can make out the gaps where the care has not been given and where care could have been given. Not that you are trying to validate it from the patient, but that's one of the methods of supervision. Then the other is indirect method. Indirect method is different kinds of records and reports are there in the ward. We have the nursing notes. Each nurse is supposed to maintain the nurse's notes. You go through the nurse's notes and you check whether the patients have got the complete care or not, why the treatment was given late, why the signature are not there. Now the records and reports will help you to understand as a supervisor that your nurses are doing the proper job for the patients. Also, we have staff meetings, another method of supervision. In this method, we try to see that we hold the meetings and discuss that how we can improve the patient care and what all can be done and what difficulties the nurses are encountering to see that the patient, because the patients are not getting quality care. In your book, it is also mentioned as technical versus creative supervision. Technical care is the nursing care. Creative supervision is a supervision where you direct, you guide the nursing personnel. Also, cooperative and authoritative. Cooperative is you guide, direct. Authoritative is you order. So this is what we had been discussing. Scientific versus intuitive. Why am I telling you to give sponge bath to this patient? To turn the position or to give hot maxal fomentation to the patient on the site of induration of injection. That is what is very important. Now, as the time is running short, I would like to just quickly complete through some of the slides. Let's go to the styles of supervision. The styles of supervision, one is task-centered, where the supervisor is only concerned about the work is to be done, not concerned about the welfare of our nursing personnel. Employee-centered supervision is where the nurse is only concerned whether my employees are comfortable or not, so that if my employees are comfortable, they will be able to provide very good nursing care to the patients. Another is autocratic or critical. Always I am criticizing to the system, criticizing to my nursing personnel, and that's approach which is not very comfortable with the person who are being supervised. Benevolent supervisor is the one who gives a long rein to the people, to the supervisee, that you can really do the good job when you are left to work. And then, of course, there is a democratic supervisor who leaves everything to the staff nurses or to the people who are being supervised, so that they can do on their own. But for that, the nursing personnel have to be very committed, very accountable, that you don't need any supervision. So these are some of the styles of supervision, and if you say within 1 minute, I can quickly go to the qualities, because the time is very short. We have the qualities of supervisor. Can I have the slide, please? It talks about thoroughness. A supervisor needs to be thorough in her intellectual abilities, in her technical knowledge, in her attitudes. If she or he is not thorough, cannot provide the supervision and guidance to the nursing personnel. Fairness in the approach. Fairness up to an extent that nobody is said that you are partial to such and such person. You are a human being. You may have liking for some, but it should not be very apparent by causing damage to another person. Initiativeness. Should take initiative to improve the nursing care of the patient, to improve the welfare of nursing person, to see that the quality care system is practiced. Enthusiastic. Instill that enthusiasm in your staff. If new idea is given by the staff nurse, try to implement and see the result, because you will find there will be improvement. Emotional control. You find that the patient has induration. Do not start scolding the staff nurse in front of other people, because as a supervisor, you have to remember that your nurse has to keep on working there. You maintain her dignity also. Should have the teaching ability and good communication abilities, and also should have an appropriate general outlook, an outlook which can really demonstrate to the others that how important it is for you to carry on. Let me just conclude it by saying, nursing is a profession in which the nursing personnel deal with complex needs of human beings. An effective, intelligent, compassionate, caring and concerned nurse administrator with effective supervision abilities can be a role model for nurses working under her or him. This in turn will improve the quality care provided to the patients, job satisfaction to the nursing personnel, and achieving the organizational goal.
Thank you very much, Madam, for taking very good session. I think all of you gained so much from Madam's lecture. Thank you, our student from here, Delhi studio and Srinagar. Thank you, Mrs. Hasina. Yes.
Oh, she has a question. Okay, one second. The benevolent supervisor is the one who tries to consider the welfare of her workers. That is what the word English benevolent means. That she or he is concerned about the welfare of her or his workers. So once she or he is concerned about the welfare of the workers, in turn the workers will also provide the good care to the patients. As the time is short, I will give you that much of meaning only.
Okay, when you go for counseling session, you can ask question to your teacher. Thank you all.
Thank you so much.